Good evening, Doc. Good evening po sa lahat. Now, continuation po tayo sa tongue coatings and the 8 principles. Number 2. Okay, we have here naman mga slides ng tongue. First, this is the case of a female 26 years old. So, ang tongue description niya, slightly pale. So, check na po natin yung tongue. This is a slightly pale, swollen po siya, namamaga, and slight teeth marks dito po sa side. Kung titingnan po ninyo, may mga teeth marks. So this indicates that there is a slight spleen chi deficiency, accumulation of dampness. Next, tongue description, there are red points at the tip and sides. So ito po yung mga parang points na mga maliliit sa may sides, tapos sa tip. This indicates that there is heat in the blood. Next, yung slippery white coating with greasy yellow coating in the posterior third. So kung titingnan po maigi yung tongue, yung posterior third po, yung likod ng tongue, meron siyang slippery white coating with greasy yellow coating. Ito po, na yellowish coloration. So this indicates accumulation of damp cold transforming into damp heat in the lower burner. Okay? Tingnan po maigi natin yung itong tongue. So ang symptoms po ng patient, pero siyang binges of eating sweet. So mahilig po siya kumain na matamis, overweight siya, red and dry, itchy skin in the winter. Yung Western diagnosis niya is none, and yung background to disease, irregular eating habits, excessive consumption of sweet food. Okay po? So next slide, we have the 67 years old female ulit. Ang tongue description niya is pale. So observe po natin yung tongue, indicating that there is a spleen lung qi deficiency. Next, meron siyang swollen right half of the tongue. So kung alin po yung right side natin, yun din po yung right side pag nag-indicate tayo ng description sa tongue. So dito, may swollen right half of the tongue. Ito po yung right side niya and swollen. So this indicates that there is dampness obstructing the channels. Next, meron siyang slippery white thin coating. So slippery white thin coating. This indicates accumulation of damp cold. Next, meron siyang slight notch at the tip of the tongue. So kung i-observe po natin, dito po sa tip ng tongue, meron po siyang parang indentation. And this one indicates that there is heart qi and blood deficiency. Okay po? So ito pong patient, meron siyang symptoms ng cough with white thin mucus. Meron siyang frequent urination, lack of appetite, and may dry mouth. Ang Western diagnosis, meron siyang coronary heart disease. Ang background to disease, physically overworked for many years, hard working conditions, and nagsisigarilyo siya for 40 years. Okay po? Next slide, we have 54 years old male. Ang tongue description, meron siyang very pale tongue. So this indicates that there is spleen qi deficiency, blood deficiency. So observe po natin yung tongue, meron siyang slippery white thick coating. Okay? So ang indication nito, meron siyang long-standing cold dampness transforming into phlegm. Okay po? So ang symptoms ng patient, meron siyang frequent bouts of diarrhea, meron siyang shortness of breath, tiredness, feeling of heaviness in the extremity dahil po dun sa dampness, and inability to fall asleep. Okay? Sa Western diagnosis, wala po. And yung background to disease, meron siyang excessive consumption of raw food. So mahilig siya kumain ng raw food. And excessive physical activity, meron siyang excessive use of sauna. So sa case history, si Mr. P, 50 years old, often suffered from bouts of diarrhea. His stool were watery but not particularly smelly. He was very tired. Even though his body felt heavy, he still forced himself to exercise a great deal. After his daily training program, he used the sauna. So pagkatapos niya mag-exercise. In order to stay fit, he chose a diet consisting mainly of salad and fruit. He also had difficulty falling asleep, but once asleep, he sleep well. So hirap siya mag-start matulog, pero pag nakatulog, tuloy-tuloy naman. His tongue was pale and showed a slippery white thick coating. So meron siyang slippery white thick coating. His pulse was frail and submerged. Okay? Sa analysis, excessive physical activity and consumption of raw foods weakened the transportive and transformative function of the spleen. So yan po yung function ng spleen and hindi niya nagagawa. Owing to the deficiency of spleen qi, fluids accumulated and transformed into dampness. Since hindi nagagawa ng qi ang TNT niya, so nagpo-form ng dampness. This was manifested in the loose stool and feeling of heaviness in his body. The pale tongue body with slippery white, thick coating, as well as the weak pulse also reflected this pathology. Okay po? The inability of Mr. P to fall asleep was caused by heart blood deficiency. So dahil po sa heart blood deficiency, hirap po siya makatulog. This was due to both insufficient blood as a result of spleen qi deficiency and excessive sweating which injured the blood. So dahil sa spleen qi deficiency, hindi hirap makaproduce ng blood, and with excessive sweating, so mas na-injured po yung blood. Okay po? So another slide, we have case of a female, 25 years old. Sa tongue description, reddish and swollen. So observe po natin yung tongue po niya is reddish and swollen po, malaki. This indicates accumulation of dampness with heat. So swollen, kaya po damp, meron dampness, and reddish, so this indicates heat. Yung red points at the sides naman indicates slight heat in the liver. So ito po yung mga red points sa my sides. So there is slight heat in the liver. Ang slippery white thick coating with greasy coating in the center, dito po sa my center, meron siyang slippery white thick coating, greasy din. So this indicates accumulation of dampness with food stagnation. So pag nakita po natin ito, we have to interview the patient whether meron po siyang food stagnation sa middle burner. Okay, yung symptoms, there is morning sickness with vomiting and nausea. Meron siyang epigastric fullness after eating. Meron siyang lower abdominal pain, slight uterine bleeding. Sa Western diagnosis, meron siyang threat sa miscarriage. Ang background to disease, she is physically overworked and excessive consumption of fatty food. So mahilig po siya ng mga fatty food. Okay po? So next, we have again a female, 37 years old. Ang tongue description niya, meron siyang reddish, slightly contracted tongue body. Okay? Contracted tongue body. So this indicates slight kidney deficiency. Ang red points at the tip naman, kung i-observe po ninyo, Yung tongue niya may mga points dito sa may pinakatip ng tongue. This indicates heat from deficiency in the heart blood naman. Yung slippery pale yellow coating, meron siyang pale yellow coating, slippery. This indicates acute externally contracted damp heat. And yung yellow thick greasy coating in the posterior third, dito po sa may likuran, greasy coating ulit. This indicates onset of transformation of damp heat into heat and sinking of damp heat. Okay po? So, ang patient natin dito may symptoms siya, slight fever. Meron siyang acute diarrhea with foul-smelling stools. Nagbabamit. Meron siyang stomach pain and exhaustion. Sa Western diagnosis, acute summer flu. And yung background to disease, meron siyang inappropriate clothing and consumption of raw food. So, mahilig din siya kumain ng raw food. Okay? So next, we have a male, 44 years old. Ang tongue description niya, pale red and swollen. So observe po natin yung tongue. This is a pale red and swollen. This indicates that there is a spleen-chi deficiency accumulation of dampness. So kung na-observe po ninyo kanina pa, pag there is a swollen tongue, this indicates spleen-chi deficiency and accumulation of dampness. Ang reddish naman with slightly swollen sides. So reddish with slightly swollen sides. This indicates that there is retention of damp heat in the liver and gallbladder. So tingnan po natin yung tongue. Yung slippery pale yellow. So meron siyang slippery, pale lang yung pagka-yellow. May thick coating, thicker at the posterior third. So yung likuran po ng tongue. So this indicates accumulation of dampness transforming into damp heat in the lower burner. So there is presence of dampness nag-transform to damp heat. Ang symptoms ng patient natin, there is occasional lower abdominal pain. There's frequent urination. Ang urine is turbid and there is thick, sticky sperm. Sa Western diagnosis, there is chronic prostatitis and sterility. Ang background to disease is unclear. Okay po? So next patient, we have female, 47 years old. Ang tongue description, there is pale swollen. So pale po yung tongue and at the same time swollen. So sabi ko nga kanina, pag swollen, we have spleen-chi deficiency and accumulation of dampness. Ang tongue niya is long, vertical crack in the midline. So meron siyang crack dito sa midline. Observe po natin. This indicates that there is constitutional weakness of the heart. So pag maka-observe po tayo ng long vertical crack in the midline hanggang dito po sa may tip ng tongue, this indicates constitutional weakness of the heart. Yung red points in the middle of the tongue sides, so dito yung middle with red points, this indicates that there is presence of heat in the stomach. Yung slippery pale yellow coating covering the entire tongue body, so there is a slippery pale yellow coating. Okay? Observe po natin yung tongue. This indicates that there is retention of damp heat in the stomach. So ang patient, ang symptoms, nagbabamit po siya, meron siyang nausea, may abdominal pain, watery diarrhea, meron siyang slight fever, feeling of severe weakness, anxiety, and fearfulness. Ang Western diagnosis, ang patient merong acute gastroenteritis. Yung background to disease is meron siyang food poisoning and long-standing emotional problems. Okay po? So next patient, we have the male, 59 years old. Ang tongue niya po is pale red with swollen and red sides. So pale red po, swollen and red sides. This indicates retention of damp heat in the liver and gallbladder. Okay po? Observe natin yung tongue. Meron din siyang long midline crack. Ito po, long midline crack. So this indicates constitutional weakness of the heart. Okay, tandaan po natin yan. Next, meron siyang thick, slippery yellow coating, especially in the center of the tongue. So thick, slippery yellow coating, center of the tongue. So this indicates retention of phlegm, heat in the stomach, phlegm miss the heart. Okay po? Ang symptoms ng patient, meron siyang mental retardation, slow to understand, poor hearing, numbness of the fingertips, smelly urine at night. Ang Western diagnosis, ang patient meron siyang diabetes mellitus type 2. Ang background to disease, possible birth defect, and excessive consumption of sweet and fatty food. So, ganito po yung description ng tongue niya. Next patient, we have a female, 50 years old. Okay, observe na po natin yung tongue. Meron siyang pale red. Pale red, and this indicates light spleen deficiency. Meron din siyang red points at the side and tip of the tongue. So hanapin po natin, observe. Meron siyang mga red points sa sides and tip. This indicates acute, externally contracted, wind heat with penetration to the interior. So acute siya, externally contracted, and pumasok sa interior. Next, ang tongue, meron siyang slippery white, thin coating, transforming into yellow coating in the center and posterior third. So, kung titingnan natin maigi, yung posterior third ng tongue, there is a yellowish coloration. And ito po is a transformation ng slippery white thin coating nag-transform into yellow coating. Lumipat na po dito sa may center and posterior third. So this indicates externally contracted dampness transforming into damp heat. Okay po. So ang patient may symptoms ng burning sensation sa urination. So pag nakaramdam po tayo ng ganito, we could also check our tongue whether we have this kind of tongue description. Meron din siyang turbid urine. Acute episode of diarrhea after consumption of fruit and alcohol. Meron siyang runny nose, itchy eyes, dry cough, especially at night. Sa Western diagnosis, ang patient meron siyang acute cystitis, acute allergic rhinitis, chronic sinusitis. Ang background to disease, irregular eating habit. Okay po? So, sa case history, Mr. G, 50 years old, complained of an acute burning sensation when she urinated. This started only a few days prior to her examination. Since the urine was turbid and strong smelling, she assumed that she had a bladder infection. At the same time, she experienced acute hay fever. Meron siyang itchy eyes and runny nose were very uncomfortable. Occasionally, after consuming fruit or alcohol, Mrs. G suffered from acute diarrhea. So, meron din siyang diarrhea. Besides red points at the tip and the sides of the tongue, there was a slippery white, thin coating that became yellow towards the center. Her pulse was floating and tight. Sa analysis, Mrs. G suffered from two complaints simultaneously, a sensation of burning during urination and an episode of acute allergic rhinitis. So, ang complaint ng patient, burning sensation pag nag-urinate, and meron siyang acute allergic rhinitis. The penetration of externally contracted dampness contribute to both. So, ang pagkakaroon ng dampness, nakapekto po both dito sa allergic rhinitis and burning sensation sa urination. The dampness met with heat in the interior and transformed into damp heat. as reflected in the yellow slippery tongue coating. The turbid smelly urine and the burning sensation during urination were the result of impaired bladder chi due to the sinking of damp heat. Okay po? In addition to the externally contracted dampness, the patient also suffered from externally contracted wind heat, as reflected in the red tip and sides of the tongue. The clear, watery nasal secretion was an expression of this factor, while the itchy eyes resulted from the attack of wind heat. The fact that fruit and alcohol triggered acute diarrhea was an indication of the presence of retained damp heat in the interior. Alcohol can cause internal heat, and fruit can cause dampness, as its cooling nature weakens the spleen chi. Both alcohol and fruit reinforce the underlying pathology. Sa discussion, a wet and slippery coating can indicate externally contracted dampness as well as internal dampness. So, pwede externally and internally na dampness. In both cases, dampness encumbers the spleen and causes the chi of the middle burner to stagnate. Okay po? On the other hand, spleen chi deficiency can give rise to internal dampness, which over the long run can transform into damp heat. Imagine still water that is turbid and gives off a musty smell. This corresponds to damp heat. In order to get rid of the smell, the water must be cleaned and move around. In the body, this means that strengthening the spleen chi so that it is again capable of properly transporting and transforming ingested food. So, kailangan po i-strengthen natin yung spleen chi. The dampness can also be moved and eliminated from the body through diuresis. Okay po, thank you for your attention.